Hi everyone, I have the honor of introducing to you Dr. Himanshu, INICET November 2022, rank 3, great rank and an awesome performance. So Himanshu, tell me, how are you feeling today?
Feeling very, very good, sir. Very good.
And what was your expectation before the exam? Like how much rank did you think you will get?
Based on my GTs, I expected my rank to be around 30, sir. Like I calculated that it might not go beyond 30, but then seeing a rank of 3 was a great surprise for me, sir.
Awesome, awesome. And also, better tell me, how was this exam as per your understanding? What was the difficulty level of this paper? And
Uh, I,
how do you
yeah,
think this paper was?
I would say it was a easy to moderate paper, sir. But the only problem with the paper was the length of the paper, sir. Like 200 questions. I mean, I feel people who have attempted all 200 questions would have had a better chance at the exam than those who probably like spent a lot of time attempting the first 180 based on the length. So the length of the question was more of an issue than the difficulty level of the paper, sir.
Okay. If I may ask you, which set did you appear for? Was it morning or evening?
Afternoon session, sir.
Afternoon session. And how many questions did you attempt?
So I attempted 197. Like I knew I have to go beyond 190, and I attempted 197. Sir.
Okay. And do you think going aggressive helps in a exam like this? Going more aggressive, attempting more helps to get into the top bracket?
Yeah, definitely, sir. I mean, for INICET, I knew that you have to be either in top 100 or beyond that. There is no point. So 185 plus was in my mind from the beginning. But seeing that it is a slightly easy paper, I went even more aggressive, and I thought that I have to attempt 195 plus. And for those questions where I could attempt, eliminate two options, I went for it, sir. Like seeing that the probability of getting right is around 50%, I went for it, and I eventually ended up getting up 197 questions.
And any particular topics or any particular things that you think were more represented in this exam as compared to your NEETPG exams, or any particular observations?
I felt that compared to conventional exams, the number of one-liners were a bit more, and the second issue probably was that the image questions were not that clear. Topic-wise, I didn't see any particular representation. I mean, how an INICET paper usually is, that's how the paper usually was, is how I felt it. But then, in terms of, I would say images were not clear, and yeah, that was probably one of the issues with this paper.
And how did you manage the questions where the images were not clear? What did you do to, get to the answer in those questions?
In such cases, like I remember there was a question of metronidazole, and they gave a picture of a palm, and nothing was visible in that. It was just a palm. And then I looked at the four options, and I felt like, okay, it might be a fixed leg eruption, and like it was more like I looked at the options more than the image. And if I felt that a particular option made more sense, then I went for that option.
In an image-based question, always looking at the choices always helps more than the image. In If you start with the option, it always helps, especially in an exam where
Yes,
the images are low resolution. And
yes, sir.
Himanshu,
Yeah.
I want to know from you that do you think appearing for the DAMS CBT, DAMS tests, do they help you in mimicking the exam environment, and you are able? Do they help you to push yourself to better limits?
Uh, yes, sir, definitely. I think multiple reasons are there for that too. Like the timing of the exam is such that it is exactly like around 1 month before the actual exam. So when you appear for the exam, you know your weaknesses, and when you know your weaknesses, you actually have 1 month to work upon it. So the timing of the exam is just too perfect. And compared to all other GTs, I think the best thing that DAM CBT does is that it provides you an exam experience. Like you see people around you, at least 30 people are there around you answering the same question. You're sitting for a 3 hour thing, I mean, which may not happen if you're giving a GT in a mobile. And whereas when you give it on a computer with others, I think it gives you an exam experience. And through this CBT, I think what helped me the most was that I took this as like real INICET exam. I was probably like around 50 to 60% prepared. I went for it and I answered each question like I would do in an actual INICET exam. And I wanted to see how many guesses will I get right. So that all that analysis definitely helped me a lot in boosting my rank. And in the CBT, I got a rank of again 31. My rank was 31. So, and then I
Okay.
knew what are my weaknesses, what are the questions I need to work upon, and that's how I improved with my. ranks.
So I want to tell the listeners that we are going to conduct two more CBTs this year, one in January, one in February for the NEETPG exam. And the ranks in the CBT are very predictive. So they give you an insight on what level your preparation are, but we give you good time to improve also. So I don't do the paper right before the exam. Do it 1 month before the exam.
Radiology is my gold standard for radiology. That is definitely there. And then apart from that, your YouTube videos, whatever DAMS has uploaded, such things like I remember Ruchi ma'am's video on how to approach a case of diplopia. So there are certain cases which which videos I have seen.
So thoughts on people who may not have done well in this exam. Any particular thoughts? Anything you want to share with them?
I would say, like, so for example, this is my second attempt in INICET. I gave my first attempt in May INICET, and I would say, like, look at this exam as a stepping stone. Like, look at it how what you did wrong, analyze the paper. There will be, I mean, for me, from the May INICET exam, what I took home was that I'm weak in the subjects. I mean, weak in the topics which I have to mug up, and that revision strategy has to be strong. So obviously you look at the answers that you got wrong, and if you think that okay, these are the things that I have to revise multiple times, make a list of all those things and do a proper 1 month and 10-day revision strategy. I think that will definitely help in your next exam. And if next INICET is your goal, make sure that you finish off all your syllabus before the NEET exam itself, so that you know where you stand and what kind of a revision you need, because again 2 months gap is there between NEET and INICET. So like, do not think this as a failure, instead think this as a stepping stone to your ultimate success, sir.
How many revisions were you able to do before INICET exam?
So for my May INICET exam, no revisions. Like, I just finished the topic and I gave the exam. So this time I knew I have to revise. So I finished my one revision 1 month before the exam. Second revision I took around 20 days. Third revision another 10 days. And the last revision was 1 day. Like, I reduced the number of things I have to revise. But overall 4 revisions of the things that I wanted to revise, I revised 4 times.
This year, you also have the importance of previous year questions. Any thoughts on previous year topics?
I think definitely, sir. I mean, if you cannot complete an entire subject, I think the best way to approach that subject is look at the previous year topics. You know, and what topics are important. I mean, from the entire book, you will get to know what topics they're focusing on time and again. Around that topic, you can. I mean, if not the same question around that topic, the similar question will be repeated. So not doing previous year question and going to an INICET exam, in my opinion, is a huge blunder. I think irrespective of whether they ask it or not, I think it covers a major chunk of important topics, and so you have to do at least 3 years and if possible 5 years of previous year question before attempting an INICET exam.
Yes, definitely. Ideally, 5, but at least 3 years should be done of INICET papers and the previous AIIMS PGI paper. If you can go up to that, it will always give you the extra edge because the topics are often repeated. And Himanshu, any words of wisdom for the future aspirants?
I would say, like, revision is the key, and if you think that you want a particular branch and from a particular college, do not settle with what you have got. You should know what your ability is, what your weaknesses are, what your strengths are. Work on those weaknesses, you will definitely improve. Give a lot of GTs. The GTs will tell you where you stand with respect to the other aspirants. You will get a rough idea of where you are, and based on your strengths and weaknesses, improve upon yourself. And yeah, never settle, never. I mean, that's the
Any message to future Damsonians?
yeah. For example, even the PYQ part of the CBT, that I just wanted to add upon that CBT had a lot of PYQs, and I think that also gave me a boost to, like, I have to focus on PYQs. I mean, that also gave me a confidence that yeah, papers will come like this where a lot of PYQs are there and the concepts will be repeated. So and continue using it. Eventually you will succeed with whatever platform you're using. If you use it properly, you will succeed. So yeah.
So I wish you all the best, better for your future. Which branch are you going to take?
So I'm planning for neurosurgery in Niman.
Best of luck. I wish and pray that you get the branch of your choice in the place of your choice. Heartiest congratulations with you.
Thank you so much.
Thank you, Vita.